Welcome to Autism Knows No Borders, a podcast where people connected to autism inspire change and build community. Together with the Global Autism Project, I'm your host, Rachel Harmon, a professional with over a decade of experience in the field of autism services, outreach, and advocacy. What factors make the biggest difference in the quality of life of autistic individuals? Whether you're autistic yourself or care for an autistic loved one, you'll want to listen to this episode with Dr. Catherine Lord. She shares some of the findings from her groundbreaking longitudinal study, which began in 1990 and continues to follow a community sample of over 200 autistic individuals. This is one of the largest and longest-running studies of autism ever conducted. Dr. Lord is an American psychologist and researcher credited for co-developing the Autism Diagnostic Observation Schedule, or ADOS, and the Autism Diagnostic Interview-Revised, ADIR. This episode is part 2 of our conversation, and we discuss Dr. Lord's research tracking autistic individuals over decades, factors which predict positive outcomes in autism, autism across the lifespan when it comes to employment, relationships, and independence, the importance of community support, what's next for autism research and what areas need more attention, and tips for clinicians working with autistic children. In this episode, discover what's possible when you support from the start. And now I present you Dr. Catherine Lord. Okay, Kathy, let's switch gears. I'd love to talk about your longitudinal study, which is really quite groundbreaking research. You've been tracking autistic individuals over decades. So could you tell us about that and how it got started?
Yeah, so this study got started in the early 90s, and it was just when Lovaas and ABA were making claims that if they started with 2-year-olds and did intensive ABA, they could cure 50% of autistic kids. And so I was at that point in North Carolina at TEACH, which is a state-funded program that offers free services around the state. And mostly the kids that were referred for autism were 4 or 5, but we were beginning to get referrals of very young kids. And so one of the questions was, can you even diagnose a 2-year-old reliably? Do kids that we say have autism at 2 really grow up to be 3-year-old and 4-year-olds with autism? So we managed to get money from the NIH to see every child who was referred under age 3 in basically 4 out of the 6 TEACH clinics around the state of North Carolina, which was really nice because much research is often done with upper middle class families who live right by hospitals, who are very aware of research. These were people all over the state who we could see for free, and we just plowed over there. I mean, the minute someone called us, we would go see the family at home. We would see the child in the clinic nearest them. And the idea was, are these diagnoses going to be real? Can we diagnose 2-year-olds? And at first, I think we thought, oh my gosh, these kids are so little. They're so cute. How could you possibly say they have autism? But after seeing 200 of these kids in the course of a few years, we realized you can diagnose autism at 2. And there are kids who are missed, so we should be clear about that. But we really figured out ways we could do it. And then we loved these kids and these families who were such good sports for putting up with initially what we did not know we were doing. And so we had money to see them again at 3 and at 5. And in the meantime, I moved to Chicago, but I was able to keep seeing the families in North Carolina. So we started a new cohort in Chicago with the same study. And then we had data at 5, and then we've just kept going. So they're now 34, 35 years old. These families and the participants, who are now adults, have been so patient with us. I think what's unique about the study is the time. It's also the population, because these are real people.
Yeah.
And we've been able to see them in person because we travel to them about every 3 or 4 years. So I think we've seen the average is about 8 times from the time they're 2 to 33 or 34. And then we also make these poor families and participants fill out questionnaires or do phone interviews every week. For a while, we were doing it every 3 months, but now every 6 months. So we started with 250, 254 to be exact. We have about 150 families still in. We lost people because of cell phones. When cell
Oh,
phones came in, people's phone numbers changed. And then they changed for a while. You couldn't hang on to your phone number. So that was the worst thing that happened to us. But other than that, the families have been just incredible, as have been the participants who now know us pretty well.
yeah. Well, that's amazing that you've been able to sustain it all these years. And what have you found as far as factors that seem to make the biggest difference in predicting positive outcomes? Anything that surprised you?
Yeah, I think there have been lots of things that have surprised us. There's really two sets of factors, I think. One set is internal to the child. So I do think that kids who develop fluent speech, have, long sentences and can talk about things that are not present by about age 5, which people always suspected, but it's absolutely true. You almost need that for sure to be completely independent as an adult. It doesn't mean if you don't do that, it still means you can do a ton of things. So it is not that these kids are hopeless in any way, but language is just the core. And we could not predict though at 2 based on language, because most of the kids we saw at 2 did not talk or did not talk much. You can't predict there. At 2, you can begin to predict by a child's nonverbal skills, but you need to be careful. And we do not want to write off kids because they're not able to do a lot when they're really little. But the issue is very gradually, are they acquiring language? And particularly from 2 to 3 to 4 to 5 in that period. There are a few kids who are on that track, but slower, who catch up, but it's very rare. So that's one thing that's both, it's a bit depressing in the sense that we would like all options open to all kids, but it is also really an advertisement for early intervention and focus on communication when kids are little. So that's one finding that I don't think is surprising, except that it was so powerful. I think the second issue, though, is we really can't predict mental health in these little kids except aggression. When you have aggression, either to, particularly to other people, I mean, a lot of autistic kids, when they're little, bite their hand or bang their heads. But if they are aggressive to other people and no one works to figure out why and how are we going to prevent this, how are we going to support this child for whatever reason they're aggressive, then the aggression really affects their lives forever. So we also need to be more on top of it if you have a 2-year-old who is really pulling their mom's hair or banging their head on people or throwing things across. It's not that they're doomed forever, but we need to address that because it's cute when you're 2, but it doesn't necessarily go away by itself. And then I think the other issues are when you get to adulthood, much depends on how happy the kid is and how, is the child depressed? Are they super anxious? Are they driven? Those factors make a bigger difference really than their IQ in terms of how happy they are and how happy their families are. And so we really want all the time to be thinking about what supports this child. I mean, that is the affirmation that we were talking about, not necessarily autism affirmation, but what can this child do and how can we keep them happy and relatively relaxed and keep aspiring to things. And that is a different track. It's not the same thing as learning language or becoming better at school. It really is a separate thing, and we need to always pay attention to that within a family.
Hmm. That's really interesting. Do you think the happiness and the lower levels of anxiety are predictors because the adult is then more open to looking for employment or like different situations or being put in an environment that is uncomfortable?
Sometimes, I mean, I think that they just have a myriad factors because I do think, an adult who may be very competent, but who is depressed is gonna have a hard time, for example, going on job interviews. I just watched a video of one of the women we followed who was talking about she's never worked, she's 34, very bright, and she was talking about, "I'd like a job where I don't have to be around other people because other people make me nervous." And the problem is, how do we help her get enough skills? So there are jobs where you don't have to be around too many other people, but we can't. She lives way out in the boonies in North Carolina, and how do we help her get the skills that would allow her to do that? And so that does affect her motivation, but it's not just motivation. I mean, I don't think she's being willful. I think it's really hard.
Yeah. So are you saying that families can start at a younger age, even adolescents, to try and teach their children some of these kinds of coping strategies even?
Yes, and I think if families very, very gradually introduce the idea of, like, responsibility and, like, you can do something for us. It's not for you. You're doing something that helps me or helps a neighbor is even better. One of the things we found in the group of people who have autism and don't have intellectual disability is if they had little part-time jobs, which might be 2 hours a week, in as teenagers, they were more likely to get a job at once they'd graduated, for example, from college. And these are like mowing someone else's lawn, or taking someone else's garbage out. It could be 10 minutes. But I think this idea that you can do this and succeed and that people are really pleased with you and that moves forward. So I think it's not that families have to do huge things, but just trying to make time for some of these things that as a parent, it's hard.
Mhm. Yeah. And what have you learned about how autism changes across the lifespan?
Oh my goodness. Yeah, I mean, it does change. It changes in everybody. I mean, even though I'm saying, "Wait a minute," like, the aggression is hard, I think, I mean, we have such a variety of people at age 34, and some of the things are constant. Senses of humor, someone being funny is constant. But I do think for even in the people that are the most impaired, who very much don't talk and don't do a lot of the things that we think of as independence, they gradually do more if they're in a supported environment. So I think that the range is huge, and we don't wanna rule out anything. We just wanna be realistic about what can this person do in an ordinary circumstance, and then how would I need to change that? Is that possible to change it so that they can have more independence and more chance to stick up for themselves?
Mhm. Hey, Rachel here. Do you know anyone else who might benefit from listening to this episode? Maybe an autistic person wanting to grow their community, a parent wanting to support their loved one, or a professional wanting to develop their skills. I encourage you to share this episode if you'd like to help them out. And now, back to the conversation. What are some of your ideas of how communities can better support autistic adults?
I think we need places for them to live, gradually places and a variety of different places. So it could be highly supervised, a house with 3 young men that has somebody there, 2 people there all the time, but it also could be apartments where somebody lives in the apartment who they could call on all the time, but where someone could live on their own. And we need to be flexible about how to do that. Families also need to think about transportation. People have to get somewhere, and if they can drive, great. Probably half of the people with autism who don't have intellectual disabilities now drive, which was just unheard of when I started. They can do it, but half can't or really don't want to. So then how can they get in from place to place? And we now have Waymo, we have Ubers, but that gets expensive. And so where are people located, and just thinking through that. And then I think we need to have jobs that really range and that are not necessarily, some of them might be full-time, some of them might be part-time, but we need to, again, be realistic about what can someone do that they would enjoy and they can contribute, because I think there's something for almost everybody. But we get caught up in, like, this high-tech company is gonna hire 3 autistic people who have to get there on their own and, have to have a degree in engineering, and that's great for those 3, but it doesn't help at all when I have somebody who can talk in short sentences and would love to work, at Panera Grill, go, and could do something. But we can't expect people to just pay for this if we're not gonna support it.
Okay, got it. So, what's the future of your longitudinal study?
We are plugging along. Um, so I think that we have money right now from the National Institute of Aging to study the caregivers. We got really told resoundingly, which was very depressing, that no one cares about 30-year-old autistic people when we're applying for money. I hope that will change. We will keep at it. We also have money from a donor to actually see the autistic people. So we will continue for the next 3 years. And then I think hopefully my former students will take over and keep doing this. It's interesting because the practicalities of NIH, there's funding to look at dementia and funding with very young kids, but people are relatively uninterested in the middle, which is awful. And we will fight to keep doing this because these people have put up with so much, and I feel like we've learned so much from them.
Yeah, it's really important, the findings that you're able to share that will hopefully eventually shape policies in the future as well. So, looking at research as a whole in general, what shifts in autism studies have been most encouraging?
I think that we have a body of literature which is not perfect, but does show that early interventions can make a difference. One of the problems in the United States is we always hope that we can do something and then forever it will be solved. Like we have kids in, TK, and then they're going to be, you know, perfect for the rest of their lives, which is not true. But I think that is a body of literature we can believe. I think that's good. I think that we have a lot of neuroscience and a lot of genetics. There is a great deal of hope among the geneticists that they will be able to use eventually what they're finding out to treat somehow medically kids who have clear genetic disorders. So far, that hasn't happened, and I think it's going to take a while, and it also is not relevant for most autistic people. It's really relevant for kids who have these genetic disorders. But I do think that, yeah, there are groups of families where all the kids have the same disorder allows for much better research. And then I think we have the neurobiology, which is, I think, established that autism is not a place in your brain. You don't have like an autism tumor or place, but it has to do with connections, or circuits. But we don't know what to do about those circuits. We don't know when do we want to change them and when don't we want to change them. So I think that is far from leading to simple solutions.
And then it gets a little bit, into eugenics
Yeah,
and cures, and there's a lot of controversy there. So
I
yeah.
I agree. I mean, I don't think I'd want someone to be changing my brain circuits unless I was so depressed that I couldn't move, and even then, it's scary. So I agree. I think it's hard to know what to do about that. I do think we've had a number of very good programs that have been able, for example, to provide supported employment or get people jobs. But I do think that they are not available to the majority of people, and they aren't as flexible across the range of skills and needs as we need. Because I do think there are some people who want to work 40 hours a week or 80 hours a week, and other people who would just be exhausted, but who could do a really good job for 20 hours a week. I think there are people that could move up within a system gradually. We've seen it happen in the longitudinal study where people had very sort of minimum wage jobs and then were encouraged to move forward in taking more responsibility. But that's the exception, not the rule. So I think we know what to do, but we don't have money to do it. And how we fit that into our society right now is not clear.
Mm. Yeah, sometimes it takes someone with a real interest in autism to invest.
Yes.
Yeah. What age do you usually start with there?
ADOS says, I mean, a child needs to be walking
Okay.
when ADOS, and that's just because you have different social interactions if you're upright, and also if you can move across a room
Okay.
on your own. So that's the minimum requirement for an ADOS. So there's a toddler ADOS that you could give to anybody who's walking.
Okay.
And then there's also adult versions of the ADOS. So there is a adult version for people who are verbally fluent, and there are also adult versions for people who have less language now. So we've been able to modify it so we're not giving adults who are minimally verbal still baby toys, which was a concern before.
Right.
So all of those are relevant. I think that the adult versions are less accurate, so we need to be careful. I think
Okay.
the adult versions, we are better able to identify about 80% and rather than 90 or 95%. We have to be careful. The specificity also is less clear, particularly for very, very delayed adults. That is, the majority of people who don't have physical disabilities who are minimally verbal will come out autistic if you give them an adult ADOS. And so we don't know, is that just autism or is that our measurement?
I see. And there is a way to detect early autism in infants, right? Like with eye tracking from 3 months old.
Yeah, it's not, I mean, it's not yet reliable.
Okay.
You get group data. So kids who will later be autistic look different than as a group than kids who will not later be autistic. But on an individual level, it's not reliable.
Okay.
And even the eye tracking, when you move up closer to 2, it's quite complicated in terms of interpreting it because where they got the biggest effect was in change over time, not a point in time. So I think there's a lot of interest in it, but so far it's not something you would depend on to make decisions.
Okay. Okay. So typically walking age, you're saying. Now, what about the autism, which I don't really hear people talking about so much anymore, but like the regressive autism, where a parent will say, well, my child was gaining all these skills. And then when they hit 18 months, they started regressing.
Right. I think that actually a very high proportion of autistic kids lose some kind of skill during the end of that second year of life. What's interesting is that in order to lose the skill, you have to have it. So if you're going to stop talking, you have to have started talking. So part of the loss of skill is kids who actually started talking and then stop. As far as we can tell, that is not different from the rest of autism. So even though it's quite remarkable to a family, for example, who has a child who may even say 2 or 3 words and then stops talking, it's heartbreaking. So I think it's something families remember, and it is striking. But what's interesting is there's actually a list of about 10 skills like pointing and clapping and all kinds of things. And many autistic kids lose 2 of those skills, but not the other 8. So it looks like it's a phenomenon maybe of having very automatic things that babies do that then don't necessarily make sense to the child. And so they drop off. And then many times they relearn them. There are some kids, very, very rare kids, who develop more language and more skills, and somewhere between 2 and 3 or 3 and 4 have a dramatic loss of skills. And that does happen and is also really heartbreaking. I think in a fair number of those cases, you can find something neurological that causes the loss, but not all of them. And so we don't know quite what to call them or what to do about them. It doesn't seem related to vaccines or to any phenomenon that we can find. And it's very rare. So families should try not to worry about it because it doesn't happen very often. But just like anything can happen, it can happen.
Okay. Well, thank you for clarifying that. Now, I'd like to close with one last question. What advice would you give to clinicians working with autistic children today?
I would say to clinicians that what we want to do is be as hopeful as we can, but realistic. And so be sure that you have enough information about a child. Don't jump in with minimal amounts of information. You need to know how much language does this child understand and what can they say and who else are they working with and what are they doing? And then what is important to the parents? And then I think we also sometimes we give parents lists of like 35 things they should do. And I think that's just unreasonable. Try to figure out what is the highest priority that will make this child's life better, that the family can possibly do, and then focus on that.
Okay, great advice. Well, thank you so much for sharing your insight with us today. I think this episode is going to be really valuable for our listeners, whether they're clinicians or family members or even autistic people who might be curious of the behind the scenes of what goes on to get that diagnosis. So thank you. Thanks for tuning in to Autism Knows No Borders. If you enjoyed this episode, please share it with one person who you think will find value in it too. By doing so, you'll be helping our mission to improve access to autism services around the world. Thanks for listening. Take care.